Hello, everyone, and thank you for joining us for the New to Medicare Foundations of Part D webinar. My name is Bailey Lawson. I am one of the specialists on the Provider and Outreach Education team, or PO team, at WPS, and I will be your speaker today. Assisting me today is my friend and colleague, Mary Muko. She'll be monitoring the chat and helping me with the background stuff during this webinar. You may hear her towards the Q&A portion of this presentation, but that's Mary, that's the other voice. I do have some housekeeping to share with you before we get started today. We do have training materials on our website, so if you've not yet downloaded the presentation for today's event, you can do so by going to the Training Center webpage. I've also asked Mary to put that in the chat for you as well. It's on our live events webpage where there is a link to the presentation materials for today's event. You can also send your questions and comments in the chat, and Mary, like I said, will monitor that for me. And of course, following today's event, you'll be able to tell CMS and WPS how we did or what else you would like to see on a brief survey, which is specifically to get our learners' feedback. This doesn't have to be specific to Medicare, just let us know what you need from us. We begin our event today with this disclaimer. We include this disclaimer in all of our events. We do so in order to remind learners that although we've made every effort to provide current information that is correct, it is subject to change. It is on the CMS website where you will find those laws, regulations, and rulings that determine final coverage, and it is these that will always prevail. Just as a reminder, CMS does prohibit recording of this presentation for profit-making purposes. We are recording it and we'll have this as an encore, so if you do want to go back, you'll have the opportunity to do so on our YouTube channel or on our encore presentations page. It'll just take a few days to see that, but we will have that up for you following the event. Before we do get started, I did want to let you guys know of an event we are hosting on October 16th. This event is our Education Expo, and it's called Medicare Madness. This expo covers the life cycle of a claim. There will be 6 sessions available for you to customize your day. This education is especially great for those who are new to Medicare. I'm going to have Mary place something in the chat that will help you register for the event. They are separate sessions, so you can pick a couple or all of the events or just one of the events if you want. Like I said, it's very customizable. It's very fun, and we have a Halloween theme for October, which I am biased to because Halloween is my favorite holiday, but I think it'll be super fun especially with that theme, so make sure you grab your seat. So moving on to today's event. Today, the hope is that you'll be walking away with an understanding of what Medicare Part D is. We're going to do this by going over exactly what Part D is, the basics of the plans, and what the coverage includes. Keep in mind, we will direct you if you have any super specific questions to the plan. I don't know if you did attend my Medicare Advantage, it's kind of the same message as that one. We personally don't have much knowledge of the Part D. Sorry, I almost did it again, Part C. Part D. So you'll have to go to the specific plan if you do have questions about specific coverage, claims, and all of that. But I do want to just preface this by saying that I just want to get this information to you so you have a little bit of knowledge of what Part D is, but we can't answer specific questions. So this education is something that is important because there are, sorry, it's coverage that does help for pay for brand name and generic drugs a beneficiary may need. It is optional and offered to everyone with Medicare by insurance companies. So like I was saying, and other private companies approved by Medicare. So like I was saying, when you have specific questions, you'll have to go to those insurance companies and private companies approved by Medicare. And no two plans are alike. So that's why I say you have to go to the specific one. But even if a person doesn't take prescription drugs now, they should consider getting Medicare drug coverage to avoid paying a late enrollment penalty fee if they do join a plan later. And I'll go over that. But Medicare Part D, it is Medicare drug coverage. So. And like I was saying, this education is something that is really important because these are the numbers of those who are enrolled in Part D. There are 55.8 million people who have enrolled in Medicare Part D. With that broken down, we come to 31.6 million people who are enrolled in conjunction with a Medicare Advantage plan, and 23 million who have Part D coverage as a standalone coverage. This is a very large quantity of people, so it's important to know the basics at the very least. And remember, again, we at WPS do not have specific answers about plan specifics because we don't process Part D claims, so you'll need to go to that specific plan for more detailed information. I just want you to create a working knowledge of Part D so that you are more equipped in your Medicare journey, because I do know a lot of you here are very new, and with these numbers, you will likely see Part D plans frequently.
Okay, so is drug coverage or prescription drug plan, and you may see this as the acronym PDP, and that is what that stands for, is prescription drug plan. Medicare drug coverage helps pay for your prescription drugs. It's optional, but it's offered to everyone with Medicare. And like I was saying earlier, even if a person doesn't take prescription drugs now, they should consider getting Medicare drug coverage. If they were to decide to not to enroll when they first become eligible and didn't have any other creditable prescription drug coverage, like drug from a late enrollment penalty. And this is added to their monthly premium if they join a plan later, past first eligibility with no other drug coverage. So generally, you'll pay this penalty for as long as you have Medicare drug coverage. To get Medicare drug coverage, a person must join a Medicare approved plan that offers drug coverage. Each plan can vary in cost and specific drugs that are covered. So there are two ways to get Medicare drug coverage. The first is through Medicare drug plans. These plans add Medicare drug coverage to original, or you may hear of it as traditional Medicare. So original Medicare, same thing as traditional Medicare. Some Medicare cost plans, some Medicare Advantage, private fee-for-service plans, and medical savings account plans. You must have Part A or Part B to join a separate Medicare drug plan. The second way is being enrolled through a Medicare Advantage plan or other Medicare health plans with drug coverage built in. You get your Part A, Part B, and Part D, the Medicare drug coverage, through these plans. But remember, you must have both Part A and B to join a Medicare Advantage plan. So this is where the and is, Part A and B. And not all Medicare Advantage plans offer drug coverage. Most do, but not all. If you would like more specific information on Medicare Advantage plans, I do have an Encore from a webinar I did last month, and I'm going to have Mary add that into the chat in case you missed that, but you can get all the info on Medicare Advantage plans and where that falls with drug coverage and all of that. So when enrolling, there's some criteria a person needs to meet for either original or, again, traditional Medicare, or for Medicare Advantage plans. For original Medicare, a person will need to have Medicare Part A or Part B, and they will need to be a U.S. citizen. For Medicare Advantage, they will need to have Medicare Part A and Part B, because remember, as Medicare Advantage, you have to have both anyway, and be a U.S. citizen and live in the service area of the chosen plan, because Medicare Advantage is there are service areas and you have to live in that service area. So if you want to plan a specific plan, but it's not available in your service area, you need to pivot and figure out something else. So that can affect the Part D coverage that you're wanting as well. So just keeping those things in mind. And when enrolling, there are also some things to consider as the beneficiary. So checking if the plan covers your prescriptions and includes the benefits you need, first and foremost. Asking your doctors and pharmacies if they're in the plan's network. Reviewing costs like monthly premiums, deductibles, and the estimate of your yearly costs for the drugs you take. If you have other health issues or drug coverage, talking to your benefits administrator or other insurance provider before you make any changes to your current coverage is something you should consider. And if you live in another state for part of the year, check if that plan will cover you there as well. So these are all just things to think about when picking a plan. So to join a plan, the main way that a person can join is just directly contacting the company that provides the plan and going to them directly. A person can call or go to their website. Another way is by mailing or faxing a completed enrollment form. I've added another resource here on this slide that can be visited, which is that medicare.gov/plan-compare. This is just for those visual people. You can see it listed out. Or you can call in to the number 1-800-Medicare, or that translates to 1-800-633-4227. And this is a place where beneficiaries can have their questions answered about things such as enrollment of a Part D plan. In terms of when to enroll, you can join, switch, or drop a Medicare drug plan or a Medicare Advantage plan with drug coverage during these times. So in initial enrollment, initial enrollment period, is when you first become eligible for Medicare. You can join a plan. Open enrollment period is from October 15th through December 7th each year, and you can join, switch, or drop a plan. So you can change your mind, but these are the dates that you can actually do something about changing your mind. And your coverage will begin on January 1st as long as the plan gets your request by December 7th. The next is Medicare Advantage open enrollment. And that's only if you're obviously in a Medicare Advantage plan already. And that is from January 1st to March 31st each year. And you can switch to a different Medicare Advantage plan, or you could switch back to original Medicare and join a separate Medicare drug plan once during this time. So, it's very fluid. So if you want the Medicare Advantage, you're originally on original Medicare, you can switch to Medicare Advantage. If you're on Medicare Advantage, you can switch to original Medicare. If you don't like this Part D plan, you can try for a separate Part D plan through a different insurance company. So it just matters about the dates. So I just wanted you to have those dates. If you have to pay for Part A and you sign up for Part B during the general enrollment period, which is January 1st through 31st, you can also join a Medicare drug plan when you sign up for that Part B plan. You'll have 2 months after signing up for Part B to join a drug plan. Your drug coverage will start the month after your plan gets your request to join. So those are also some things to consider is when. So although the enrollment date, like open enrollment it ends December 7th, your coverage doesn't start until January 1st. So those are some things to consider as well. The total cost for Medicare drug coverage will depend on the plan you choose. So like I said, no one plan is the same. It's not one size fits all, so it's very dependent. But depending on the plan, the things that you can pay is a premium. And a premium is a monthly amount you pay for coverage, whether you get covered drugs or not. The specific premium will depend on the plan chosen. You may have to pay more depending on your income. So who pays a higher Part D premium because of income? If you have to pay a Part D late enrollment penalty, it'll be added to your monthly premium. The Part D late enrollment penalty is an amount that's permanently added to your Medicare drug coverage premium. You may owe a late enrollment penalty if at any time your initial enrollment period is over. There's a period of 63 or more days in a row when you don't have Medicare drug coverage or other creditable prescription drug coverage. After you join a Medicare drug plan, the plan will tell you if you have to pay a penalty and what your premium will be. You'll generally have to pay the penalty for as long as your drug coverage is active. So like I said, permanent enrollment fee. And that's if you don't have, so if you opt out of the Part D, you don't choose to enroll, this is if you don't have other coverage in place for a reason to deny the Part D or not enroll in the Part D. So some other things you could pay is a deductible. This is an amount you pay for covered drugs and items each year before your plan starts to pay. Your deductible will depend on which plan you choose, once again, and no Medicare drug plan may have a deductible that's more than, in 2015, it was $590, and in 2026, it'll be $615. Some plans have no deductibles. So if you are, let's say, I'm trying to think of an example here. If you have a deductible of, in case you're new to deductibles, if you have a deductible of $200, you will have to spend $200 in drug coverage in, prescription drugs, before your plan will start to pay for. So once you reach that $200, then you will pay, then that's when your insurance will start to pay. You could also pay a co-payment, and this is a fixed amount you pay for a drug at the pharmacy, again, dependent on the plan. And you could also pay a co-insurance. So this is a percentage you pay for a drug at the pharmacy. And a lot of times what will happen with coverage is you'll pay that deductible first, and then you'll pay your co-insurance. So let's say you have to pay 20% and then your plan will pay 80%. So if you are paying $100 for a prescription, once you've reached that deductible is complete, you'll pay $20. and your insurance will pay 80 if it's 100 because they're doing the percentage split. Usually this will have a fixed amount as well. So you'll pay 200 in your deductible, and then your co-insurance, you'll reach, let's say, $500 where you pay out of pocket, and then your coverage will pay everything. It's confusing. It's a confusing system. I have more, again, if you look at my my Medicare Advantage Part C, new to Medicare Part C, that breaks down premiums, deductibles, copayments, and insurances more. And it's a little less confusing when we're talking about plan of care rather than plan of drug coverage. So make sure you take a look at that if you're confused about any of that. Generally, Medicare drug plans and Medicare Advantage plans with drug coverage have 3 stages. So I'm going to go over the stages with you. So first is the deductible stage. If your Medicare plan has a deductible, you will pay out-of-pocket costs until you reach the full deductible. Again, no Medicare drug plan can have a deductible that is more than $590. That's 2025. Once we reach 2026, the cost will go up. The deductible cannot be more than $615. Some Medicare drug plans don't have a deductible, so keep that in mind. Again, all dependent on the plan. Excuse me, sorry. Next is the initial coverage stage. After you reach your full deductible, if your plan has a deductible, you'll pay 25%. So these are kind of the percentages I was talking to you about earlier of the cost as co-insurance for your generic and brand new drugs until your out-of-pocket spending on covered Part D drugs reaches $2,000. So the example I was giving was a little less, but so that's $2,025 is $2,000. Again, in 2026, it's going to go up to $2,100. So that deductible, that out of pocket, will go up a little bit. This is including certain payments made on your behalf, like through the Extra Help program. And then you'll automatically get to catastrophic coverage. And that stage is you won't have to pay out of pocket for covered Part D drugs for the rest of the calendar year. So again, you'll have your deductible, which is the $590 for 2025. And we're just going to stay in 2025 so I don't confuse you because we're still in 2025. You'll pay the $590 for the deductible stage. Then you'll go up to your initial coverage stage, which is where you pay the 25% of coinsurance. And that'll be up until you spend $2,000. So it's not in one fell swoop you spend $2,000. You're gradually getting there. So every time you spend, it'll go towards that $2,000. Once you reach that $2,000, then you've hit catastrophic coverage stage, and everything else is paid. So you likely will get to catastrophic coverage stage if you've got a lot going on and you take a lot of meds, and you got let's say heart, like blood pressure medication, heart medication, like the whole 9, and you're spending quite a few dollars on your prescription drugs. That's how you'll get to catastrophic coverage. If you're just, it's a monthly $12 prescription, you're likely not going to get to catastrophic stage. You may not even get to initial coverage stage if you're having like low paying drugs that are not, you know what I mean? Like it takes a bit to get up to catastrophic. When you do have Medicare drug coverage, you'll get an explanation of benefits, or you'll see it marked as EOB is the acronym. The month after the pharmacy bills your plan, your explanation of benefits shows the prescription you filled, what your plan paid, what you and others have paid, your coverage stage, and what counts towards your out-of-pocket costs and your total drug costs. also. A plan's list of covered drugs is called a formulary. A plan's drug list can include both brand names and generic drugs, as well as original biological products and similars. Can I speak today? Biosimilars, sorry. Biosimilars. Each drug list includes at least 2 drugs in the most commonly prescribed categories and classes, but plans can choose which drugs they'll offer. All plans must include most drugs in certain protected classes on their drug list. So the protected classes include cancer drugs, HIV and AIDS drugs, antidepressants, antipsychotics, anticonvulsants, immunosuppressants for organ transplants, to list a couple. A plan's drug list or formulary might not include a specific drug. However, in most cases, a similar drug should be available. If it is believed none of the drugs on a plan's drug list will work for a certain condition, you can ask for an exception. An exception is when a drug plan decides to cover a drug that's not on its drug list or to waive a coverage rule. A tiering exception is when a drug plan decides to change a lower amount for a drug that's on its non-preferred drug tier, and a person or their provider must request an exception, and a prescriber must provide a supporting statement explaining the medical reason for that exception. A Medicare drug plan can make changes to its drug list during the year under guidelines set by Medicare. A plan may change its drug list during the year when drug therapies change, new drugs are released, or new medical information becomes available. Earlier, I stated that biological products and biosimilars were covered, and I just wanted to touch on what exactly they are, even though apparently I can't say them to save my life. I'm going to tell you what they are. A biological product is a prescription drug that is made from natural and living sources. So that's like animal cells, plant cells, bacteria, or yeast. A biosimilar is a biological product that must be highly similar, hence its name, to have no clinically meaningful differences from the original biological product in terms of safety and effectiveness. An interchangeable biosimilar may be substituted for the original biological product at the pharmacy without a new prescription. Almost said subscription, new prescription, and that's subject to state laws. Medicare Part B covers a limited number of outpatient prescription drugs under certain conditions. Usually Part B covers drugs you wouldn't typically give to yourself. So like those you get at a doctor's office or in a hospital outpatient setting. Medicare drug coverage covers drugs Part B doesn't cover. So if a person joins a plan with Medicare drug coverage, they can check their plan's drug list to find out what outpatient drugs it does cover. In most cases, Medicare Part B doesn't cover the drugs you get in a hospital outpatient setting. They're sometimes called self-administered drugs that you would normally take on your own. Your Medicare drug coverage may cover drugs you get in a hospital outpatient setting under certain circumstances. You'll likely need to pay out of pocket for these drugs and then file a claim to your drug plan for a refund, but you'll have to contact the drug plan to find out how to file a claim. Or that, I should say, the beneficiary's drug plan. If you have end-stage renal disease, Medicare Part B will pay for some of the drugs you need, like the injectable drugs and their oral forms, and biologicals, including things used for dialysis. Your Medicare drug coverage will cover most end-stage renal disease related drugs that are available only in oral form. And I compare the Medicare Part B with D because usually people will have them in conjunction with each other. Medicare drug coverage must cover all commercially available vaccines. So that's like shingles, RSV, tetanus, diphtheria, vaccines like that, when medically necessary to prevent illness. And you'll pay nothing out of pocket for Part D adult vaccines that are recommended by the Advisory Committee on Immunization Practices. So, drug plan rules. Medicare drug plans may have rules for if and how they cover drugs. These rules can be called prior authorization, step therapy, quantity limits, medication safety checks, drug management programs for safer use of opioid plans, and medication therapy management programs for complex needs. With prior authorization is approval based on specific criteria that you or your prescriber must get from your plan before your plan will cover certain drugs. The prescriber may need to show that the drug is medically necessary for the plan to even cover it. Plans may also use prior authorization when they only cover a drug for certain medical conditions, but not others. When this occurs, plans will have other drugs on their drug list for the other medical conditions that the prescriber is using to treat that drug, using the drug to treat, not treat the drug to treat. You or your prescriber, you as in the beneficiary or the prescriber, or whatever the case may be, can contact that plan to ask for an exception to prior authorization. An exception, again, is when a drug plan decides to cover a drug that's not on its list or to waive a coverage rule. You or the prescriber must request an exception, or the doctor or prescriber, whoever it may be, must provide a supporting statement explaining their belief that because of the medical condition, it's medically necessary for that person to be on the drug, even if you don't meet the plan's prior authorization requirements. If the patient will have a negative health effect if they take a different drug, and a different drug that if it would be less effective than the one that you're wanting the patient to have. Step therapy is a type of prior authorization that requires you to try a less expensive drug on the plan's drug list. That's been proven effective for most people with that condition before you can move up a step to a more expensive drug, hence step therapy. Some plans may require you to try a generic drug or a biosimilar if it's available for that specific drug, or a less expensive brand name or biological product that is on their drug list. The prescriber can contact the plan to ask for an exception to step therapy. The prescriber must give a statement, again, supporting the request, which includes their belief that based on your medical condition, it's medically necessary for you to be on a more expensive drug without trying the less expensive drug first, that you'll have an adverse health effect if you take the less expensive drug. And again, the less expensive drug would be less effective. And for quantity limits, plans may limit the amount of drugs they cover over a certain time period for safety and cost reasons. For example, a plan may only cover 30 tablets of drug per month. The prescriber can contact the plan to ask for an exception if the prescriber believes that because of that medical condition, a quantity limit isn't medically appropriate. For example, your patient needs a higher dose. So let's say the drug only comes in 5 milligrams, but they need to take 10. So then they'd need double the amount, would be an example. To lower costs, many plans place drugs into different tiers or levels that are on their drug list. I had mentioned tiers a little bit earlier when we were talking about prior auth and all that stuff. Each plan can divide its tiers in different ways. Again, very dependent on the specific plan, so you'll have to go to the plan for questions. But generally, a drug in a lower tier will cost you less than a drug in a higher tier. For example, and again, plan tiers may be different, so just keep that in mind. Tier 1, this will have the lowest copayment and will have the most generic prescription drugs. Tier 2, medium, you'll have a medium copayment and preferred brand name prescription drugs, but still having those generic drugs. Tier 3, a higher copayment, which is, but you'll have non-preferred brand name prescription drugs still having the option of generic. And then specialty tier is the highest copayment with very high cost prescription drugs, very specific, very pinpointed. You can kind of, if you're very about getting a specific, like let's say you have a specific drug that works for you and you have to have the brand name, without doing any exceptions, you can do the specialty tier. It'll just cost more. So tier 1 is bottom, going up in numbers. So 2, you're kind of raising the level. Tier 3, raising the level, and then specialty tier is like the golden tier. In some cases, if your drug is in a higher tier and the prescriber thinks you need that drug instead of the similar drug that is in your lower tier, the prescriber can ask the plan for an exception to get a lower coinsurance or copayment for that drug that's in the higher tier. And remember, plans can change their drug list at any time. But your plan must notify you of changes to their drug list that affect the drugs you're taking. So this may just affect, the tier you may want to be in. So both brand name and generic drugs must be approved by the Food and Drug Administration, FDA, before they can be prescribed to people. Brand name drugs are marketed under exclusive trademark protected names and are protected by patents. When those patents run out, other companies will often produce generic versions that use the same active ingredients. So generic drugs are copies of brand names and are the same as those brand name drugs in the dosage form, in safety, in strength, in route of administration, in quality, in performance characteristics, and in intended use. Generic drugs, drug makers must prove to the FDA that their product works the same way as the brand name does. In some cases, there may not be a generic version of the exact brand name drug that someone takes, but there may be another generic drug that will work for them because of active ingredients and, other things within this list. And they may save money by using the generic drug instead of the brand name. It just is a matter of talking out of what would work best for their needs. And lastly, some things to consider, and some things to think about when a person is enrolling in Part D is the late enrollment fee. I touched on this earlier, and I want to make sure it's kind of ingrained in your brains, because that would suck for a person to get a late enrollment fee and then have to pay that for the rest of their Medicare Part D paying lives. So if a beneficiary does have credible drug coverage, they will not be subject to the late enrollment fee, which, remember, is permanent, when enrolling in Part D later. So if a beneficiary has drug coverage currently, this doesn't apply to them. It just has to be creditable drug coverage. If they have no drug coverage, this is where the late penalty comes from. And if they have drug coverage currently, they'll want to compare it to Medicare drug coverage to see which plan will benefit their needs better. Their coverage may change because of the differences in plans, their difference in needs, and one form of drug coverage may become more beneficial to them than the other. So they're always going to want to be comparing, but again, they just always want to have some form or another. So I have this list of resources for you in here, and I want to drag some over to show you, just so you can see the resources that we have. So the first thing is medicare.gov. This something important that I want you to know about this website, medicare.gov, is this is patient centric. And the reason I want you to know about this is because when you're speaking to a patient, if they come to you and they have questions, it's very easily understandable. So you will know how to answer them, because these are the questions of the patients. So if they come and they're asking, or beneficiaries, I should say, if they come to you and they ask questions, you can refer them to this. You can read over this to get yourself a better understanding. It's a lot easier to read than maybe something on CMS that is provider centric rather than patient centric because of the audience. So this may help you to get that basic understanding, and then you can move over to CMS. But I want you to have this because it's got, the basics, kind of what I went over, how the drug plans work using your drug plan coverage. I will say, again, if you have specific drug plan questions, again, you'll have to go to that specific drug plan to get the answers. But this is very good about just a general knowledge. There's that one. And then we've got Medicare and You. And again, this is the 2026 PDF, but this is also a really good resource for you. This is for the patient again, but if you click here, Part D, specifically what we're talking about, this has a ton of information regarding Part D. So we've got, special enrollment periods, which I didn't go over, but, it gives you that information. How do you switch plans? How do you drop plans? Read information you get from your plan. How much do I pay? So a bunch monthly premiums, just a bunch of stuff that goes a little bit more in depth than maybe what I went into because I was doing the basics, but this is great information and another resource that you can give to others who may be asking you the questions. So you can refer them here, or it's very helpful for you to read yourself so you know how to answer the questions. But if you have visual people, I am a visual learner, so this is very helpful to me. So I thought I would share that to you. Those are the resources. I do have the Medicare and You in here, and then how do drug plans work? If you click into that, that is that first medicare.gov that I showed you. But this is just more specifically into those different categories I showed. Show you what I'm talking about. So like, how do drug plans work? How do drug plans work? So it goes into the coverage and stuff more specifically, but medicare.gov is a great resource, even if you're not looking for Part D. So for people who are new to Medicare, I really want you to have that because it's very helpful, and it's been very helpful to me as someone who has been new to Medicare myself. So I wanted to have you guys have that readily available. All right, with that, Mary, I do see you're answering questions in the chat, but I do want to send it over to you and see if there is anything that we can help answer that you haven't answered already.
Thanks, Bailey. We did receive a couple of questions in the chat, and I was able to answer both of them during the presentation. Now, for those of you that might not have seen that, one of the questions was about something Bailey mentioned. She mentioned the $500 deductible this year and the fact that it will be $615 in 2026. Someone asked that we repeat that information about the deductible and asked if that's the amount the government will allow the Advantage plan to have. And what's happening here is we're kind of mixing apples with oranges. The Medicare Advantage plan is different than what we're talking about today during this webinar, and it's an easy thing to do. I've done it myself. Today we're talking about Part D prescription drug programs. So the answer to the question is that the deductible that Bailey talked about was the drug plan deductible, not an Advantage plan's deductible. No Medicare drug plan may have a deductible more than $590 in 2025. I think I said 500 earlier, or $615 in 2026. And some plans, of course, have no deductible. What we're talking about are the prescription drug plans. Bailey, I'm getting the tongue-tied thing that you have. The other question that that we have is, if you have one company drug plan and find that another drug company has a better plan, can you switch plans, or is there some penalty or some approval you have to pay? Well, that's really going to depend on the plan about those penalties and approvals and such. We really can't answer that because we don't know the plans, but I can tell you that the answer is yes, you can switch plans, but it's generally only during that open enrollment period. Now, there are some special enrollment periods that do pop up, and Bailey kind of talked about that already, or just kind of mentioned them. And what I've done is I've dropped a medicare.gov resource into the chat for you. This is where you can find more information about switching those plans and such, and those open enrollment periods or special enrollment periods. So good questions. We've got them all answered, and no more have come in, Bailey. So I'm going to let you continue on, and you can tell everyone how they can send questions for a period of 7 days following this event.
Thank you so much, and thank you for answering those in the chat, Mary. I do apologize if to the person who had the question, if that was confusing, because I know I have been saying Medicare Advantage within this, but like Mary said, we were speaking specifically about Part D, but there is, you know, Medicare Advantage has its own drug coverage. It's just very dependent on the plan. And like I said, there is a Medicare Advantage Encore. Mary has dropped that into the chat a couple of times. You can find it on our Encore page. It's called New to Medicare, Foundations of Medicare Part C. If you have any further questions about the Medicare Advantage plans, I do want you to have that information because, again, I know it can be confusing with me saying all of these names, but this is specifically in reference to the drug plans, not Medicare Advantage. But yeah, I just want to put that out there again, is that we do have an Encore, and Mary has popped that into the chat again. So if you do, for the person who asked the question, please check that out if you haven't already. It may be very, very useful to you. And anyone else who is listening that may have confused. And again, I apologize if it was confusing. But moving on, since we don't have any more questions in the chat, I just want to tell you about the Certificate of Achievement. So in a few minutes, you will receive an email with the subject saying, thank you for attending. This will come from the WebEx email. Do not delete that without reading it. It contains your Certificate of Achievement. The email will look like what you're seeing on your screen right here. And the Certificate of Achievement is what is in this red box. It's not a PDF. It's not an attachment or anything extra. It's just this right here underneath Certificate and Certificate of Achievement. It's got everything, the contact hours, your name, everything that you need for your CEUs. We do get some questions on that. So I just wanted to let you know about that. If you don't see it, make sure first you're adding the WebEx email address to your safe sender list. If you got the reminder emails, it should already be on your safe sender list, but also check your spam and or junk mail, depending on whatever email you use, because sometimes it can still get sent there. If you called in from a phone and you followed along on the handout materials and you're not in WebEx, you'll receive a completely different email. And this email will have the subject of sorry we missed you. This is because you did not register with your phone number. So WebEx does not realize you've attended because it's looking for that email. That's not an issue though. So you'll just want to email the wps.gha.education@wpsic.com email. And Mary will put that in the chat. I'll have it up here on the screen for you again. Just email it with that email with the subject and date of today's webinar, so I know they know to get it to me, and I know what you're talking about, and I can get you the certificate. You'll just want to send your phone number that you called in from, so I can verify attendance that way. So it's not an issue if you called in and you got the email. Don't freak out. I will get you your certificate of achievement. You just have to reach out with your phone number. And with follow-up questions, how Mary was saying, if you do think of any additional questions, even after we complete this event, have no fear. You will have 7 days from today to submit them and send them to the education mailbox. I've been saying the email a bunch, so you should have memorized by now, honestly, but it's wps.gha.education@wpsic.com. It's right there on the slide for you. You'll just want to put today's date and the new to Medicare Part D in the subject line. So once again, they know to send it to me and who it goes to, and it gets it to the right person. Keep in mind, all claim-specific questions will have to go to customer service. And this is just for Part A, Part B, Part C, and D. We don't do anything with their claims, so we can't answer any questions. Again, you'll have to go to the specific plan that claim is for. So please just take a few minutes now to complete the survey that I have talked about. Tell us what you liked, what we could do better, suggest topics for future education. It doesn't have to be specific to Medicare. Anything that you think is beneficial. We want to know that, and your feedback really is invaluable to us and ensuring education that is timely and effective. There are different options to take the survey depending on your preference, what's easiest for you. Mary has put a link in the chat. You can do it that way. Or when you exit the webinar, you'll be asked to go to an external site. It'll look like this. This is just the CMS page for the survey. The message will look like this with the yellow triangle. It's not malicious or anything. It's just alerting you that you're going to an external site. It just takes a couple of minutes. It'll just mean so much to me if you could leave your feedback. Just to let you know that we are taking into consideration what you do say on that survey. We have added chapters to YouTube. So it's like an index or a table of contents for a book. kind of like how I showed you on the Medicare and You. It just marks out in the video what when the topics change. So say today you're watching and you're like, what did Bailey say about the tiers of coverage? And I'll have it marked out in the video once I do post it, tiers of coverage, and it'll take you right to that. So you don't have to do any, we took the guesswork out for you. You can just go straight to that and save you some time. Another thing we've added is training indicators. So like today when you signed up for today's webinar, you would have seen in the description NTM, which stands for New to Medicare. We have a list of the training indicators listed, and it lets you know what they mean, so you can kind of decide whether or not that is for you, the education's for you. And with that, on behalf of myself, Mary, Provider Outreach and Education, thank you for your participation. We look forward to your survey comments and hope to have you join us for future events. Have a great rest of your day, a great rest of your week. Happy Monday, everyone. You may now disconnect.